my first video that I made, I probably wasn't as clear and in my communicating as I should have been, but I should probably explain better. I'm not a very good communicator, especially lately. I haven't been communicating that well. But anyway, like my brother gave me this advice. Yeah, man, just start recording your experiences and put it out there little by little, and maybe it will help somebody. And so I intend to do that. A lot of family, friends, Marines from my old platoons and in the past have been calling me. Some sailors and some hitting me up and on Messenger and different platforms, hitting me up, seeing how I'm doing, and we've been chatting. Some FaceTime, some of them not. It's been good hitting people up and just and talking and getting to know a lot of and reconnecting with a lot of people. So anyway, to be more clear as to why I'm here is because of the head injuries that I've had through the years, especially a couple of months ago, and having developed speech problems. I was already on a medical board before that last head injury, and I've had a lot of head injuries throughout my career, and I've had a lot of diagnosis, and I should have been more clear in that last video. But as you know, I'm not very good at communicating these things. But since being here, I've had to kind of reinvent the wheel a little bit to these doctors and tell them all my history, and they've taken all my medications out of my system. It's kind of messing with me a little bit, and also it's dangerous too because it will induce a seizure. And that's what they want to hook me up with an EEG. I think tomorrow or the next day for 72 hours, so they can track another EEG. So I'm going to be doing an EEG. I don't want to get into the type of diagnosis of seizures I get right now. I get too personal, right? But I'm willing to talk more about seizures and epilepsy, do a whole video about that later. But I tried to explain to these doctors these moments, these episodes of me going in and out of it. I guess they happen more often the longer I've gotten more head injuries in my life. At least I think they're related to head injuries. I don't know. Maybe I'm just retarded. That's what I tell a lot of doctors. I think, doc, maybe I'm just retarded, and you're over complicating things. They tend to laugh, but I'm kind of dead serious. I don't know. But anyway, today I had another episode. I thought I was asleep, but I woke up to a team full of people. Like, do you know where you're at? I'm like, yeah, I'm asleep. But they're like, we were standing here going like this to you, and you were staring at the wall, and you weren't saying anything. I kind of remember that, but I don't remember a little bit, like the details of it. I don't remember what they were saying. Coming off medication, obviously there's precautions you have to take with a lot of patients. You can experience, for different patients, or every different patients are different, but you can experience a lot of different things, So their program is set to take razors from patients. If I want to leave, I have to be escorted. If I want to go to the healing garden here, I got to be escorted. It's like a prison garden, so it's kind of demoralizing. I feel like I'm like on a crazy house, if anything. But that's going to change for me after a few more days. That will be lifted, and while I'm here getting more help, I'll be able to come and go as I please, get all my stuff back, get my shower curtain back, stuff like that. But I get it. I get the precautions that I have to take. But you can kind of tell, like, as a guy like me flying in from living a normal life and then coming here and being checked in, it can kind of be a little demoralizing. And these are thoughts. These are why Marines and sailors don't ever ask for help too, because they know, well, I don't want to be in a situation like this if I ever say the truth about my mental health or my problems, right? Because I don't want to be put up in a hospital. That's not why I'm here. I wasn't put here by some Looney Tune. And if that happens to you, that's not a bad thing either. I'm not knocking on those who that's happened to either. But for me, I came here knowing I was going to come here for TBI health. I asked for it because my cognitive functions and my test results from my last TBI clinic from a few months ago in Hawaii were really alarming. And I couldn't pass basic things. And then I had another accident and they were worse. And so like, yeah, let's get him here. So you can imagine the hesitation it is for service members and active duty Marines or anyone, any service member to want to be honest to doctors, because you get put in a situation like this in the hospital and it's demoralizing. Yeah, it feels like you're kind of going crazy. You're alone. All you have is time to think about is your mistakes, and you just like, man, am I doing the right thing? I'm doing the wrong thing. All these people judging me. My friends, I wonder what they think about me putting these posts on. This is why service members they find it hard to be honest with doctors while in service. And they find it hard to be, honest and vulnerable and say the truth. One, because it'll pull them out of the field and line of duty. It'll take them out of what they like to do best. And two, it might land them in a place like a hospital where it puts their career in jeopardy, and line them on a med board like, oh man, he's having brain injuries or whatever, and it puts your career at jeopardy, and a lot of people don't understand that. They think, oh well, just go get the help you need. It's not that simple. It comes at a cost, and doctors are pain in the ass. There's a disconnection with doctors too. They think, oh yeah, just go get, okay. If I am completely honest too with a doctor, how much am I gonna truthfully say, and what are they gonna do about it? Are they gonna take my license away for the rest of my life and say that this guy can't drive, he's a menace to society, he's crazy, he's like, I don't trust doctors in general. Who does? I should have more trust, but they haven't, never in my career have ever been. Doctors can contradict each other on opinions. I mean, it's like, how many doctors do I know these days that think there's 42 genders? You so much for that education. You're a retard. So like me, by the way. But, yeah, that's kind of the updates for me. I've had reason my voice sounds the way it is because how horrible it sounds is due to my time on the drill field as a drill instructor. So before I moved to Hawaii, I was in Camp Lejeune, North Carolina, and I had received vocal cord therapy, vocal cord treatment, right, with a laryngologist. They gave me 3 injections into my vocal cords to help plump them up so they would work better. And moved to Hawaii while I was in Wounded Warrior Battalion. I had 3 more injections and a surgery a couple months ago as well. The surgery never held as it was supposed to. They took fat from my stomach and put it into my vocal cords. But I need another surgery done on my vocal cords. Yeah, because that's something that I have to do too before I get out. So that's why I sound the way I do. My voice isn't always like this. Well, with the surgery and with the injections, my voice sounds better. But it's just going back to its old self as a raspy old drill instructor and type. That's the scar tissue, and that I think they call it atrophy of the vocal cords when your cords are not touching when they. I don't know how it is, but I just saw I have muscle tension dysphonia. My muscles around the vocal cords tense up, and they tend to compensate for what the vocal cords are not doing.